ways that this baby isn't really latching on. He's just pretending to breastfeed. And this is a very difficult problem to deal with sometimes. So we have to make sure that mothers understand that babies are not always latched on just because they have the breast in their mouth. How do we know the baby's getting milk? That pause in the chin. That's it. Look at it. Oh, look at her drink there. Look at her drink. Oh, beauty. Lots of milk. Look at that pause in the chin. Every pause is a mouthful. You see what I mean?
Looking that the chin actually drops down a little deeper and it holds. See, it holds. So watch again. When it holds, it's a mouthful. His mouth is there, and nothing there. So you see the mouth is literally filled up with milk. Take a look at the chin. We're looking for that pause when the chin drops down and holds. So suck, 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 drink. Suck, 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 drink. You see how the chin drops down and holds, so he's getting nice big mouthfuls here.
But if the baby is only nibbling at the breast, then he's going to spend a long time there. He's not going to be getting very much milk if he's only nibbling at the breast. So we suggest to the mother, get your hand around your breast. And if the baby's just nibbling while he's sucking but not drinking, then squeeze. And that will often get the colostrum, or even if it's later, get the milk flowing. And the baby will start to drink again. So if you see that the baby's not drinking, then squeeze. The baby should start to do some of these pausing types of suck. Keep the pressure up. If the baby is no longer drinking, then release the pressure. Wait for him to start sucking. If he's not drinking, compress. And keep the baby drinking that way until he doesn't drink anymore, even with compression. You get that baby breastfeeding well, you won't need to do any supplementation. So finish one side as well. How do you know the baby's finished? Well, because the baby's not drinking anymore. So take him off if he's really not drinking anymore, and then offer the other side. And of course, there's no reason you can't go back and forth several times. Well, the one reason is that if the mother has sore nipples, but if the baby latches on well, she won't get sore nipples. And so the mother can go back and forth several times. And it's surprising how frequently a baby's no longer drinking over here on the left side, say, goes over to the right side, drinks there for a while, and then goes back to the left side and is drinking again. And some mothers find this incredible. But I've already fed him on that side. Yeah, but there's still milk in the breast, I'll bet you. Okay, and then they do drink.
Now, she's starting to get a lot of nibbles in there, so let's get going with some compressions. So we hold far back on the breast, and we just squeeze. It's not a sliding down. Yep, you can squeeze from here, and I can squeeze from here. And it's not a sliding down. We're not massaging or milking the breast. We're squeezing and hold and release. This is called a compression. It's to turn those little sucks into drinks. And by the way, she's starting to tell us that the flow is changing by this body movement that she does. So a baby will lie still, peaceful like an angel when they're happy with the flow. But the minute that flow changes, they start to, well, they move. They move their hands.
So I thought that was gas. It's not gas?
No, not at all. And in fact, you know, a baby can react so violently with the knees drawing up and pounding at the chest and pulling back and going like this.
And stretching my nipple.
These compressions simulate letdowns for the baby, and they stimulate letdowns in the mom. There are some moms who take a little while to let down, so we do the breast compressions right from the very beginning. Then the milk starts gushing out, we ease up, we don't need to do the breast compression anymore. Then toward the end of that breast, as baby's draining it, we may need to go in with the breast compressions toward the end there to keep up that consistency of flow. Okay. There are some women who need to do breast compressions throughout, and there are some who do absolutely none whatsoever.
Groups of cells, it's almost like grapes in the breast, and they're all producing milk. And sitting around these cells and groups of cells, there are little muscle fibers. And when a baby starts to nurse at the breast, there are signals that are sent to the mother's brain that say to the brain, oh, there's a baby suckling there, make the milk go faster. And the muscles contract, and they push the milk forward. And so that's what happened when this baby was hardly drinking on this side, and all of a sudden she started to drink plenty. The mother had a letdown reflex, or a milk ejection reflex. The trouble, though, that happens there, too, is that if the baby doesn't really nurse well, then the milk supply actually can decrease. So you get sort of a vicious circle of baby doesn't feed well, baby doesn't gain weight, baby doesn't feed well, baby milk supply decreases. And why is that? Because the baby is initially not latched on very well. And we know a baby's not latched on well. We hear it all the time. It hurts when I put the baby to the breast. Well, if it hurts, then something's wrong. Unfortunately, too often, sore nipples are considered a normal part of breastfeeding, but they're not. Okay, so what do we do for sore nipples? The best treatment for sore nipples is prevention. We get that baby latched on well from the very beginning. If we get that baby skin to skin with the mother so the baby latches on all by himself, that baby will latch on well and the mother won't have pain. And I think that this is the one thing that we can do for mothers that is just incredible, because it can be painful. In fact, a lot of mothers say it's worse than labor. Well, it shouldn't be that way. And I think that that's another thing that a lot of health professionals need to learn. Too many are telling mothers, oh, it's normal for nipples to hurt for the first 3 or 4 weeks. Well, it may be common, but it isn't normal, and it can be fixed. And we shouldn't allow mothers to suffer for such long periods of time. What should the baby look like? The baby goes to the breast, hits the breast with his chin. The chin touches the breast, but not the nose. He's covering more of the areola with his lower lip than his upper lip, and he's slightly tilted up towards the mother. And we teach that with this cross-cradle type of hold. And what's the treatment for sore nipples? A good latch. Supplementing may be necessary from time to time. There are truly women who haven't produced enough milk or won't produce enough milk, partly because the baby got off to a very poor start, partly because, in fact,